This is Ashley Mintz, and I'm here to talk to you about an innovation that will create a more efficient tomorrow. So, to share a little bit about myself, during high school, I was involved in a lot of groups and organizations such as the National Honor Society, Science UIL, the Biomedical Sciences Academy, and Orchestra. I am planning on attending the University of Oklahoma this fall to pursue a bachelor's degree in biology with hopes of going to medical school in the future to become a pediatrician. With that being said, I was so excited to be interning with Dr. Justin Smith at Cook Children's Pediatrics in Trophy Club, Texas. And he actually graduated or obtained his MD at UT Southwestern. And he was just an incredible doctor to shadow and intern for, and it was an amazing experience. So, to share a little bit about my experience in the pediatrics facility, it was kind of first interesting to see the difference between maybe a adult's doctor's office versus a children's doctor's office. And one of those was the vision exam that people have to take in order to see like how good their eyesight is. Well, for children, whenever they can't read the alphabet, they actually have this vision exam that I showed on the screen, which actually is objects instead of letters. And so what they would do is they would walk the child up to the vision test and ask them, for instance, what the cup stood for, or what they would point to, and they'd be like, what is this? And they would have them to name it, because some people may call it a cup or a mug or a sippy cup even, but as long as their name for it would stay consistent throughout the exam, then that would decide whether they passed or not. And then another experience that I had was with this new innovative flu and strep test. It actually used nucleic acid amplification, which kind of changed the general 60 to 85% accuracy to almost 100% accuracy. And it can even detect if you have the flu or strep before your first fever. So it's very new and innovative, and it was just incredible to see. But it is quite an expensive technology to use, so it is $200 per test. So Dr. Smith also kept another flu and strep test exam that was still 85% accurate, but it was a lot cheaper just in case if people didn't have maybe health insurance, so it could be more affordable for them to still get tested to make sure that they stay healthy. So I thought that was another thing that was kind of compassionate towards their patients, which I appreciated very much with the learning. And so, with going through this medical facility, it was an incredible experience. But I also talked to Dr. Smith about what improvements could be made in just the medical health field in general. And so, something that he was talking to me about, as well as whenever I was researching it, and three factors that I kind of wanted to center on was organization, communication, and efficiency. So, 23% of healthcare professionals felt that they had an inefficient access to technology with organization and just making sure that everything stays on track, as well as poor communication that actually had led to deaths across hospitals and medical facilities across the US, as well as even nurses calling it a problem with their efficiency of being able to get from one place to the other, as well as their patients. And so, a system that I was thinking about inventing would be the MediTrack. So, this is a device that would connect the whole medical facility, whether that was a hospital or more specialized doctor as well. So, this is going to keep documentation of each patient's data for each doctor. And so it will keep also nurse records. And whenever a nurse comes in to kind of take more of the vitals and seeing what symptoms they have and any comments they need for the doctor, they will have this medical device and they will fill it out, and it will get immediately transferred to the doctor's MediTrack as well, in order for the doctor to be able to keep up with the patient's information and be able to track them. And so it also notifies the doctor whenever a nurse has left the room and is ready for them to come into the room. So this could actually help doctors kind of know whenever nurses are in the room and to not interrupt until they are done, as well as whenever doctors in the room for nurses, unless they're like being called upon, to help keep the efficiency and to have time management. But this communication is crucial to have across, especially big facilities as well as small facilities, to make sure that all of the patients are getting the care that they need to prevent any accidents from occurring. And so, to kind of go with this, there's going to be two types of Meditracks that facilities can have. And so, there's one that's more specialized for hospitals since they are they have much bigger capacities. And so, the way that these patient profiles will appear on the MetaTracks is through scanning their hospital wristband, which will, once they get hooked up to maybe heart monitors, blood pressure, pumps, and even IVs, whenever anything gets out of the normal or their homeostasis, it will alert their nurses and their doctor about it. And so this will kind of allow for a more efficient way to keep the care of the patients at the top priority and make sure everyone's getting the help that they need. As well as with medical facilities, of course, they don't have hospital wristbands normally. And so this will be updated whenever a patient comes and checks in. Their their patient profile that's already on the setting will then get sent to the doctor and the nurses that are taking care of them, and they will be able to communicate, the nurses and the doctors in between, and make sure that the patient is getting the care that they deserve and need while they're visiting the facility. And so, with having all of these vital information and data collected from these patients, in order to keep this secure, of course, the security has to be top notch. And so, these MediTrack devices will be stored in a locked case. Whenever a doctor or nurse comes in to get their MediTrack, in order to just open up the case, they would need to have face recognition, fingerprint, as well as a specialized password. And then whenever they do get their MetaTrack device, they are going to, every time they open it, they will have to have face recognition as well as scan their badge across the scanner to let the MetaTrack device know who is using it and what their patients are. And this is just to prevent everyone's information from being exposed, and so that everything will have a privacy setting. So, again, to explain why this is important is number one, patient safety. Every medical facility wants to make sure that they are treating their patients with as most efficiency and time management as humanly possible, as well as staying organized and making sure that everyone is also having a pleasant stay while they're there as much as possible, even in sometimes their rough conditions or unfortunate circumstances. This will also ease the communication stress between doctors and nurses to make sure everything stays organized and proper, but also to make sure that they are both able to communicate back and forth on any new data that they've collected or any new things that they've seen that the patient may need or they may need a checkup on. And so that is why I believe that the MediTrack would be a beneficial innovation to the medical field. And so here are my references. And if you have any other questions, please feel free to contact me anytime. And thank you so much.